So I was browsing the internet and I came across this news. I was shocked, to be honest. I want to believe that those of us working under healthcare, as a healthcare personnel, you should be trained, okay? Not just being trained, you should know that there are some things that are totally unacceptable. Particularly, I've been in this country for a couple of years, okay? They can joke with everything, but not medication errors, guys. So immediately I saw this news, I said, no, I am going to bring this to you.
Calm down, calm down. No, 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 no. Whoa, 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 whoa.
This was published by BBC News. A Lincolnshire nurse who administered 10 times the prescribed morphine dose to a patient who later died. Like 10 times, guys. 10 times the prescribed dose.
I know you gotta dress up for the club.
For those of you coming across my face for the first time, my name is Blessing. Sorry, I'm not always like this, but this actually got into me because I'm like, oh my god, what kind of error is this? So my name is Blessing, and also of Blessed Blessing channel. On this channel, I film content on information that will make your journey to the United Kingdom as smooth as possible. Also, I share information about things happening in the United Kingdom so that those of us that are here in the United Kingdom will learn, and people outside the United Kingdom that have it in mind that someday they would come into the United Kingdom will know what is happening, and of course learn their lessons from that. Yeah, so on today's video, guys, like I said, we are going to look into this article. It says a Lincolnshire nurse who administered 10 times the prescribed morphine dose to a patient who later died has been struck off. The Nursing and Midwifery Council, NMC, was told Nicola Sharp was working at Homson Care Centre at the time of the incident. A hearing last month held how, after the patient's death, Ms. Sharp took up a job at another care home where she gave an incorrect insulin dose to a patient, guys. See, talking about giving out medication, I want to believe that for anyone working under healthcare, if you are a healthcare assistant, you are a support worker, senior support worker, team leaders, like you work under healthcare, you are a nurse, you are a doctor, especially nurses, guys, we should be careful, okay? So I want to believe that most of us, we are supposed to be trained and of course pass medication competency, okay, before coming out to give patients medication. Yeah, I understand that errors do happen, okay, but then there are some levels of errors, especially medication errors, that are totally unacceptable. Like they can joke with everything, but you see that one, they can never joke with it, okay? I think this is exactly what happened. So how can you give times 10 the dose? I don't know what would have happened. Maybe she was not just in the right frame of mind before administering the medication. Before you administer that medication, of course, you know that you're supposed to read the instruction on the mark sheet. And again, guys, personally, this is what I do. If I am to administer a medication to a patient, not just the mark sheet. Yes, the mark sheet is very important. We have to follow the procedure on the mark sheet. But then again, guys, you see that medication itself, that pack, the medication pack, the instructions are always there. So even if you are confused a little bit with the charts, you know, so many charts on the mark sheet, maybe you're new to the job or to the unit, and you know, this thing you don't really understand it perfectly, guys, the instructions are always there on the medication pack. So you should know the strength of the medication. Yeah, very key. You see the strength, the dosage. Okay, for those of you that don't really know what the strengths are on medication, sorry, I didn't really plan to do this, but I think there is need for us to tutor us a little bit about medication. On that medication pack or on the mark sheet, you will see, for instance, paracetamol 500 milligram, and then you see the dosage. So that milligram there is the strength of the medication. So you must take notes of that. Another thing is that when you are giving out medication, if you are not too careful or if you are not trained, you are going to have issues. Again, if you have someone talking to you, this is what I do. If I am administering a medication to a patient and I have maybe a colleague trying to bring up something, kindly tell the person to hold on. Please wait, this is medication. I'm sorting out medication. I have to give 100% attention to this because it's very important. I can't afford to make errors that will cost somebody's life. The first thing you should do is for you to read the mark sheet, okay, and take notes of the milligram, because I think we've worked with a couple of patients that on their medications, you have a particular medication, paracetamol for instance, 100 milligram and then another 50 milligram. The total milligram is supposed to be like 150 milligram. If you are not careful, you would just go on to administer the 50 milligram for the part that says 100 milligram. Paracetamol on the match sheet, they wrote it twice, maybe because the pharmacy do not have 150 milligram, and the patient is supposed to have 150 milligram of paracetamol. Now they break it into two. You have 100 milligram and below you have 50 milligram. So you are expected to give one tablet of 100 milligram and one tablet of 50 milligram. Anything happens, or maybe during audits they find out that you gave less strength of the medication, you are going to be in a very big problem. Miss Sharp was struck off by the NMC hearing, which took place between 16th and 19th October. Head Miss Sharp had been looking after a patient referred to a patient A. They don't want to give the name of the patient, who had been receiving palliative care. I think it's good for us to know what palliative care is, okay? Palliative care is practically an emotional support for those who have a life-limiting health condition or terminal illness. So guys, you see that they understand that this patient is actually in a very critical condition. It could be that they already know that this patient may likely, pass away, but the way the patient passed is totally unacceptable. Patient A had been prescribed 2.5 milligram to 5 milligram of morphine for pain relief, but on the 19th October, Miss Sharp administered 2.5 mls. Obviously, it's an error, it's a mistake. Everybody knows that is a mistake, okay? Maybe instead of that milligram, you now administer, because it's the same 2.5 you said, as you can see on the screen, it's 2.5 milligram. So maybe she didn't read properly, she didn't check the match sheet properly, like I told you from the beginning of this video. Pay more attention on the pack, the instruction on the pack of the medication, very key, okay? Now, she administered 2.5 ml instead of 2.5 mg. And this is up to 10 times the prescribed dose. The report by the NMC stated the patient A died shortly after. Ms. Sharp was also accused of failing to record the administration and the reason for administering the morphine in patient A care notes. She was suspended from working at the home, and Lincolnshire Police launched an investigation. Of course, I know they would definitely have to investigate this, resulting in Ms. Sharp's arrest. The NMC report said an inquest in April 2021 had patient A medical cause of death was found to be effect of morphine. So they are now certain that the patient died because of this morphine, with the coroner ruling the death was misadventure. The panel heard Ms. Sharp left Thompson Care Center and took up a role Grover Core Care Home, also in the same location, in August 2020. Ms. Sharp is said to have left that job in March 2023 after giving a care home resident, patient B, 19 units of insulin, okay, instead of the prescribed 4. So after the first incident, this staff left that company and went to another company. Had another error, medication error. This time, she gave patient B 19 units of insulin, fitness to practice impaired. In its finding, the NMC found the allegation against Ms. Sharp in relation to patient A and B proven, and said her actions had amounted to misconduct. The panel was of the view that Ms. Sharp had not demonstrated any insight or remorse, and concluded her fitness to practice was correctly impaired. I could actually go on, but the thing is that at the end of the day, this particular organization tried their best to make sure the staff's license is withdrawn. So if you are working under healthcare, you may not be a nurse, because in this case she's a nurse, okay? You may not be a nurse. If you are working under healthcare system as a support worker, as healthcare assistant, guys, you have to be very, very careful. If anything like that happens to you, obviously your DBS is going to be blacklisted, and you could actually be penalized, legally for this. That is it. Do well to like this video, share this video with your friends, because it's going to save some of us some troubles in the future. Even if you don't learn anything from this video, learn that when you are giving medication, you have to calm down. Errors happens, but try as much as possible to limit your medication errors. Thank you again for watching, and I remain Blessing, a Mozozo of Blessed Blessing channels. Thank you.